there that this meeting will be recorded. So if you don't want to be recorded, please switch off your camera. And there's also an evaluation at the end of the section, and a link will be posted in the chat. I think it may already be in there. Is that the link to the Survey Monkey, Jake, that's sitting in the chat now? Yeah.
Yes, it is. Yeah, thanks.
Okay, and yes, just as it says there, you can always use the chat function, ask any questions, but there will be an opportunity as well for verbal questions or comments at the end of each of the presentations. So we've got a selection of presentations this morning, which you'll have seen on your agenda. We've got Angela Kumar here. Yeah. From Gateshead. Oh, I've got Newell. Has everyone got their mics off? I'll try again, but I had a real echo there. So yeah, first off, we've got Angela Kumar from the CCG. She's going to give an overview of the Community Mental Health Transformation Programme. We've then got David Newell and Simon Reay from Sunderland South Tyneside Foundation Trust, which is going to give us an overview of the new peer support worker roles, which are part of the Community Mental Health Transformation Programme. We'll then have a short break, and that will be followed by Ben and Sophie from Tyne and Reay Archives and Museums. So they're going to give us a presentation about connecting creativity to culture and to health and social care. And then last but not least, we'll have Jennifer Rogers and Lauren Chaffee from Involve North East, which are going to talk to us about patient participation groups across Newcastle and Gateshead and what they found from their review. So I think without further ado, and in the spirit of keeping the time, I think we can move straight on to our first presentation, which is from Angela. So Angela, I'll hand over to you.
Thanks very much, Kirsty, and hello everybody. Like Kirsty said, I'm Angela Kumar, and I'm Portfolio Manager, Mental Health, Learning Disability and Autism. It's a Gateshead system role, so it's quite exciting in that I've worked for the local authority for too many years, but I also now work for the CCG, which means that we're able to join some of this work up together, which is a really positive outcome for hopefully the people of Gateshead. So today I'm going to be giving you a bit of an overview of the Community Mental Health Transformation Programme, which is a programme that's really looking to improve the way that services for people with mental health are delivered across Gateshead. So if I can have the next slide, please. Thank you. Jake's already warned me that it's the Chris Whitty. Next slide, please. So thanks for that, Jake. So the national picture. So just to give you a bit of an overview of where we're at and what the main aims are of the community mental health transformation. So it is a radical change in terms of the approach. I think it's really important that that was one of the main areas that we wanted to work, and I think it's the integration of community. But I'm sorry, I'm just going to close this door.
I can just see there, sorry, Ange, it's just a message in the chat that someone can't see the slides. Can everyone see the slides on the screen? If you could just give us a nod or a thumbs up. Lisa, are you able to see them now or not?
We can share them at the end if you want, if that makes it easier. To be honest, it's just a bit of a guide for me, but I'll share them at the end.
Thanks, Ange. Sorry about it.
No worries. Yeah, so it is a radical change in approach, and sort of the main aim is in terms of getting some integration of our community-based services in place. Obviously, what everybody recognises is that it's really important that people are working together, because ultimately, when there's an intervention that takes place, or if you are suffering with mental health and you need some support, it's making sure that that's ongoing support and that can be delivered in the community as well. So what the main aim of the programme is looking to work with sort of primary care networks, which are the GP practices. So there's certain areas within the borough that have been split into sort of populations of around 30 to 50,000 people. And the idea is that we're linking quite closely with those those populations and those communities. So what we wanted to do is there's a group, a mental health steering group, as part of this work that's been set up. Next slide, please. And what that mental health steering group has done is really try to pull together some of those key aims. So as many of you will be aware, there was a mental health programme, Deciding Together, Delivering Together, that was running from 2016, where there was a lot of consultation, engagement, not as much co-production as we like, but I suppose a lot of discussions in terms of mental health and sort of the needs. And really this gives us the basis of where we're at today in terms of trying to understand what can be delivered in the community and how we can support that as a system, as VCS organisations, as community groups, as obviously like primary care, whether that's secondary care. So it's really about how there's a flow of services and support for people that have mental health. So the mental health steering group really was to pull together some of that work and really kind of focus on what can we deliver. So this initial 3-year programme is looking at, in year 1, what do we aim to achieve? Because I think sometimes often in the past there's been a lot of programmes that have been set up to fail because they want to deliver on everything, which is absolutely the ideal and the intention, but it's a bit more of an organised structure, hopefully, so that we could get together with groups and partners to identify what we were going to aim to deliver in our first year. So some of the things on the slide here is really about so one of the first ones was the workforce. So it was really important to understand what our workforce is made up of. And coming from a local authority background, we have a social care mental health team and some voluntary commissioned, with very small pots of money, organisations that do some amazing mental health work and support people in the community. But really it was looking at how that works across Gateshead as a place. So that's what a lot of the work that Kirsty and myself and some of the team that are working with us are looking to pull together, and we've made some really good progress to understand what that looks like. And I know David Newell, following on from me, is going to talk about some of the new roles that are coming into the system, and we're working on a lot of this together, which is a really also a positive move. So one of the things that we've done is we've tried to do a bit of a visual, which I can show you a hand-drawn image of that at the end of the slides, around what that workforce looks like across the system. So that's including our local authority partners and what groups and locality work's going on within Gateshead, as well as what workforce do we have in our primary care networks, as well as what's available across the system. So one of the other things that we were looking at is the formation of these teams based on a PCN footprint, and there's some of that work that's now being done. So there's some new roles that have been brought into the system, which are PCN mental health practitioner roles, because as we know through the pandemic and where people's mental health has absolutely been affected, we've been able to bring these roles in because we know for a fact some of those GPs need that support, specific support, so that when people do come into their practices that they can get mental health practitioner or see a mental health practitioner. One of the things that we've aimed to do, and I think this has been an ongoing discussion for some time, was introduce a trusted assessor model. So what that meant is that people weren't duplicating what they were talking about, and people didn't have to really repeat their story lots of times. So when you're seeing a service, that you don't have to tell your story over and over again. The idea is that there's a bit more of a fluid approach in terms of getting the support that you need. So actually, what we're saying is a system, we trust one another, that you've met somebody and you understand the support that we need. And I think that has been a little bit contentious and challenging, and that's still ongoing. So some of that work is still being pulled together so that we can look to see if that can be addressed. One of the other ones is to really look at some of those social determinants and some of those health inequalities. So again, is identifying what those health inequalities are in different areas of the borough, and that again is being picked up through some of those PCN groups. We've said that we would look to do a complete review of the CCG and local authority commissioned residential care beds. So as a system, we've got mental health residential care beds where people get a service, and there's a bigger review now ongoing through both partners working from the local authority and the CCG to look what that needs to look like. And it's absolutely imperative now that we understand from our partners on this call what we're able to tell you is what we've currently got, and now we really want to know is how would that work better going forwards. So again, a real opportunity to join some of that work up. One of the big things is that, and it's a national problem, but obviously within Gateshead we've started to do quite a bit of work on is joining up what our housing offer is. So strategic housing and working with our local authority partners just to improve our housing and accommodation offer. So we've done some work with our learning disability and autism accommodation, and we're still, that's still ongoing. But again, there's an absolute need to improve our mental health accommodation and how people are accessing the types of accommodation that they need. So again, we're working with our local authority partners with that. And again, there's some work going on around the homelessness to improve that offer as well. One of the big things that we also wanted to introduce, and again is ongoing work, is to develop an improved offer for personal budgets. So when you do come into, if you are receiving a service or you are in touch with the local authority, that if you're offered a personal budget, so that's the amount of money that you've been assessed for as needing to support you throughout whatever your needs are, then it's a better way of working. And how does that work for you? So again, we're looking to make sure that there's an improved offer for not just personal budgets, but personal health budgets as well. Next slide, please. So just to give you a bit of a snapshot, because there's obviously quite a lot that we committed to there, and so we wanted to make sure that we could give you a bit of a position of where we're at the moment in terms of some of that. So the current snapshot is that there has been some recruitment taking place for those mental health practitioner roles, and that's through what's called Rs. Those are additional roles that the NHS put through to support the PCNs. We've also got a project manager that's been recruited just to support the mental health transformation, so that we can join up some of this work, especially for working with what we recognise is really important is sort of the VCS and those peer support roles. So we've got a new person. We can get Gail to give us a wave at the end, or she can introduce herself as well. So she's going to be working with our voluntary sector and third sector organisations and community partners, as well as the PCNs, to sort of develop this model further to make sure that we're all in touch in terms of making sure that support's available. As we mentioned, there's new peer support roles that are coming into the system, and David will be talking about those next. So they are going to be hosted by South Tyneside Foundation Trust. But again, it's really important that we work together on how that's delivered. We've also obviously got an urgent and crisis support model, and again, we're looking at how that's improved. So when people do reach crisis, that they get the ongoing support that's needed. So currently we've got a service that's called TIAC, which is Together in a Crisis, and again they offer some great support where they can redirect people or put them in touch with services, whether it's housing or benefits, and again it's making sure that ongoing support's available for individuals. As I mentioned, the residential care beds are under review, and we're working with partners to just reshape this offer. As we know, that what we want is to make residential care is quite a restrictive model of practice, and we want to just make sure that it's open to making sure that people can move on and live as independently as possible. One of the other areas that we've been able to deliver on is the expansion of some existing services. So Tyneside Mind, who offer a helpline for people with mental health, that's now been extended, and that was just done recently in October. Next slide, please. So as I said, in terms of how the mental health steering group work and operate, what we've got is we wanted to make sure that we're accountable. So we did set up 5 main task and finish groups. So the first one's the residential care, and that was pulling together, what does that look like? How many beds do we have? How does that work? What's the throughput, if possible? And where do people need to stay in residential care? That's actually also leading on to a much more joint piece of work around looking at residential care across the borough, so that's including older persons and working age adults. So again, it's a bit of a bigger piece of work, but a lot more joined up than it's ever been before, which is a really positive move for Gateshead as well. What we've got is, and one of the big ones where I suppose colleagues on this call come in, is really that community and locality working. What we recognise is that often we discuss this as a group where you go for an intervention, but it's all of those community and locality groups in communities, and we've seen it throughout the pandemic where they fundamentally help people and continue to help people with their support. So that this group is really trying to link all of that up. So what we wanted to do is make sure that any new roles that do come into the system, or any existing roles, do work as best together with partners, because often we know that we work in silos. So you'll often be given some support and it would end at a certain period, but it's about what's available ongoing, and also what resources are in the community as well. So that's one of the groups that is set up. And the other one that I just mentioned is the urgent and emergency crisis, and again how that pathway is improved so that ongoing support is delivered at the end of that. And then there's the peer support group, which again, as I mentioned, there's colleagues from South Tyneside Foundation Trust that will discuss that, as well as some early conversations that we've started as a task and finish group, where we've got Rococo, who are also involved in that, and again they've raised some really valid points around how will that work, how will people be supported, how can we deliver that training, and again that task and finish group will give us, well, hopefully give us all of the solutions to that, and obviously give us that support for the BCS. And again, linked to the community and locality working is the mapping of community assets. As I've mentioned, there's some amazing groups, amazing individuals that currently deliver support for people, and it's really making sure that we've got access to those, and really how do we deliver ongoing support for those individuals, groups, and some of these are just very small outfits that are doing some amazing work. So what we want to make sure is that we've got them, and we can offer that support that people need. So in terms of how we're keeping track of this, just for project management, really as a tool, we've got what's just an assurance document to make sure that where we've asked for actions, or where there's some accountability, that we can go back and challenge that, and it's the steering group that really keep that focus. As I mentioned, one of the challenges is the trusted assessor, and again it's making sure that we can come to some sort of agreement around an assessment of an individual and the support that they need. So again, we're having further discussions in how that can be improved. Next slide, please. So this is the visual that I talked about. Like I said, it's hand drawn by Kirsty, who's really what we've looked to do is pull together all of the workforce that we've got in the system, and what we were trying to establish is that how does that work better together. So in some cases we've got quite a lot of teams, and you know, whether that's organisations or posts throughout the system, and it's just making sure that there's not that duplication in the system, but actually if people need access to certain information, or need signposting to a relevant service, that we can see what that is. And again, a lot of that discussion is that what do these people do, and how can they offer their support further? Because ultimately what we want to make sure is that we don't have people in hospital, that people can live healthy, full, meaningful lives within the community. So again, it's working with all those partners, and the idea is that like I said, it's done on that PCM footprint, of which we have 5 areas in Gateshead. I suppose to bring it all together is money, and there is money that's been released, and again what we want to make sure is that some of that money is available to our BCSE colleagues. So we're currently also pulling together that information around what money's in the system. So again, obviously all of these individuals and people are a cost to the system, but we want to make sure that we're getting value for money in terms of what those people deliver. But again, what money's left, so that we can support our BCS, and so that individuals are getting the right support. And I think that may well be my last slide. Yeah, so a couple of minutes earlier, and I know, apologies because I do talk very fast, so if anybody's got any questions, please give us a shout.
Okay, any questions or comments for Angela? No, I think, you know, Ange, yeah, there's obviously lots of work going on, and I think the main theme coming through that presentation was obviously trying to join everything up and some of the challenges that brings. I think what I also heard there was, you know, that you try and where at all possible to connect with community organisations and communities themselves. What would members of this group, you know, if they wanted to get involved or find out further information, how could they do that? Would we be able to put your contact details in the chat function?
Absolutely. And if Gail's on, and she can just come on video on the video, if you just want to give everybody a wave, because Gail is going to be one of the people along with myself. If we can share both our details. And even Jake's helping us out around anything where you feel what would be useful, what do you think's missing, what have you heard before and hasn't happened. So anything like that, obviously we're more than open to listen to and hopefully address where possible and really make that bit of a difference.
I'll just jump in. Hi everyone, I'm Gail. So as Ange said, if you've got any thoughts, any comments, any ideas, please just get in touch. We'll put our contact details in and just share that with her, because we can't do anything if we don't know. So please, you know, anything, just share and get in contact with her.
Thanks very much, Gail. And we've got a comment there in the chat from Michael, just to say, you mentioned funding and is there a link to see if it's an area they could access for some of their projects. So I would just urge Michael, if you could get in touch with Angela or Gail once to put the contact details in the chat, and you can maybe have a conversation with you outside the meeting, if that's okay. All right. Anything else from anyone before we move to the next presentation? No? Okay, well, thanks Angela for the presentation, and also Gail for coming on to say hello, and we'll look forward to seeing how the transformation programme progresses. Thank you. Okay, so next on the agenda, Angela mentioned a few times there that we have some new roles coming into Gateshead as part of mental health transformation. And one of, well, there's several roles coming into the borough as peer support workers. So if I can just invite David and Simon now to give us their presentation with an overview of that piece of work.
Thanks, Kirsty. Good morning, everybody. My name's David Newell. I'm a business manager within the Trust with responsibility for our mental health services in the community. And I'm joined by Simon Reay, who's our clinical lead for our adult services, and in Gateshead, our talking therapy service across various locations in the Trust. Simon's kindly pulled this slide deck together to give you a bit of flavour, I guess, because these are new and developmental roles. It's really crucial that we work in partnership with all of you in developing these roles, and particularly into primary care networks. And it's really exciting, a very positive opportunity to support people with mental health needs, particularly where they're presenting in GP practices and other settings. So if we can go to the next slide. What I'm going to do is kind of give a bit of introduction overview of the slide, and Simon will provide the expert details. There's also a bit of setting the scene in the background in relation to how these posts will be supported and developed as well. So from a provider perspective, a provider of mental health services, it's important for us to feel confident that we're able to support the development of these posts, the creation and development of these posts, and again, work with our colleagues around getting the right people into posts for these ones, and also their ongoing support and development and their career opportunities and developing further within the service. We've got a really good track record, and Simon's going to talk a little bit about that in this slide.
Thanks, David. So as David mentioned there, I think it's important that we can demonstrate that we've got confidence in delivering on the posts that we're being commissioned to provide. But I think it's probably equally important that other services have confidence in us, in our ability to provide as an acute hospitals trust. We probably thought it was just important just to, I suppose, give some background as to our delivery of mental health services within the organisation. So at the moment we have 2 IAP services, one in Gateshead and one in South Tyneside, and 3 children's services and an LD service. The South Tyneside IAP service is part of a life cycle service, so that covers the whole lifespan. And across all of those services, we've got really positive national and regional performance. And focusing on the sort of adult mental health services, we've I suppose have identified there in terms of how we meet our KPIs and how we're sort of recognised at both a national and regional level. We've got outstanding performance in terms of recovery rate. So our recovery rate is 59.9% year to date. Now the national average the national target is 50%, so we're significantly higher than that. But the national average is actually 51%. So again, if we're looking at how we compare to other services across the region and at a national level, we perform exceptionally well. We've been invited to attend 2 Department of Health best practice workshops, both adult services, and that's in regard to our recovery rate and also our access target. So that's the number of people that we actually get to access the services. So what we can demonstrate is that we get lots of people to come and access our services, and we get very positive outcomes. We've also got a number of we've won a number of awards across all of our mental health services, and within the last few years, we've won 2 Bright Ideas and Health Awards for innovative practice, and that relates to work that we did with community matrons. Where we trained all the community matrons in Gateshead, Sun and South Tyneside in basic CBT techniques. And we also won an award with regards to the implementation of the life cycle service in South Tyneside, which is the only primary care life cycle service in the country. We've had multiple research published across a variety of journals, and we've got a wealth of experience in new service development. And I think probably looking at the sort of IAP services is a good example of that, where we took on the IAP services from the onset of IAP, probably around 10 years ago, completely new services within the organisation, completely new services at a national level, and we were able to demonstrate within a relatively short period of time that that we could be effective. And looking 10 years later, as I say, we're in the top 20% of services nationally in both Gateshead and South Tyneside. Next slide, please.
So again, as Simon alluded to, we've had quite a bit of experience in relation to working with service users, other partners, etc., and particularly with co-production and engagement. And this is a really key area for these posts and the delivery of service into PCNs. So Simon will tell us a little bit more about that.
So I think when we're talking about co-production, we're talking about engagement. I think we're talking about that engagement with services who employ peer support workers, engaging with peer support workers who are currently in roles, and also engaging with those people who could potentially be peer support workers. So involving people with experienced people are experienced in working with peer support workers in the recruitment process. And I think would go as I think what we'll be looking at is actually to have people who employ peer support workers sitting on the interview panels along with at least one person who is a peer support worker themselves, in order that we're going to ensure that we recruit the right candidates to the posts. I think what we'll be looking to do is obviously, get all those services who are currently providing employment for peer support workers and the peer support workers themselves collectively to collaborate to develop sort of best practice in order that we prepare ourselves as an organisation, having not actually employed peer support workers previously, that will go in there with a really good starting point, knowing exactly what we should be delivering and how best to deliver that. I think it's really important that we get together collaboratively to map out an effective induction. I think the opportunity to ensure that And the peer support workers are prepared for the role, that they've got shadowing opportunities, that they're aware of the systems, they've got geographical awareness, etc. So that when they actually start the role, they feel that they're well prepared and they can transition into those roles relatively seamlessly. And I think we will utilise our existing experience of co-production within a variety of other services that we've delivered. Next slide, please. And I suppose what we'd look to do is maximise our own experience of working with people with lived experience. So we have a variety of service user engagement events where essentially we're looking to try and recruit people to sort of be part of our service user forum and engage in the development and the progression of services. So again, we have people who've got lived experience who currently sit in recruitment and interviews. They influence policy and decision making, and what we're looking for is people with a variety of skills and qualities. So people who maybe's got experience in admin or experience in IT. We then we involve people in reviewing materials, resources, in developing policy and decision making, and obviously where people with IT sort of skills would be really beneficial is a contribution to the development of our websites. We also currently have an autism expert by experience employee working within the service. So this is somebody who's got a diagnosis of autism themselves, who's working as part of our service, and who's looking at the journey that somebody experiences from basically the point of accessing information about the service, how they would make a referral, that initial contact with the service, the assessment, the therapy they would experience, the follow-up, etc., post-discharge. And what they'll do at the end of a period of 6 months is provide a report on how we can improve services, and obviously that's an ongoing process. So even though it's within the first sort of couple of months of this process, we've already been able to sort of make significant changes to the way that we deliver services to ensure that people with autism have a more positive experience, but also that just the general public, that having that opportunity just for somebody to look at how we deliver services has had really positive impact in the short term, and I think demonstrates that as services and organisation we're really open to feedback. Next slide, please.
Thanks, Simon. The slide looks a bit busy, but it's an indication of where the peer support workers we feel would potentially sit within each of the PCNs, and this is certainly open for development as well. But what we want to be able to ensure is that we've got that support across all primary care networks, and we've got the support for the peer support workers within those networks. And you'll notice at the bottom of the slide as well, we've also got some recruit, train children's psychological wellbeing practitioners in there as well, with some CBT therapy support. So again, we've got the pathways through and as well as peer support workers delivering support in their own right, they're hopefully surrounded by other professionals that are able to assist where that's required. Simon, did you want to add anything more about that slide?
No, I think it's just to sort of make it, I suppose, explicit that in each of the PCNs there will be a Band 6 community mental health development worker, a Band 4 senior peer support worker, and a Band 3 peer support worker. What we haven't got in that slide is that there'll also be a clinical team manager who will be managing the project, and a clinical lead who will be overseeing the whole process. But we'll talk a little bit more about those roles further on in the presentation.
Next slide. So recruitment strategy is quite important, as well as we mentioned before. We want to have the right people in post. We also want to be able to offer that, or not want to be able to, we will be offering that support for them when they are in post, and that support for their development and training on an ongoing basis. So Tyne will talk a little bit more about that strategy.
Yeah, so I think it's absolutely key from the onset that, you know, we have, again, the sort of network involved in broadcasting these posts, because obviously what we want to do is try and attract a wide range of potential peer support workers and ensure that, you know, we recruit the best candidates available for the post. I think in terms of our strategy, I think what we'll be looking to do is I suppose try and highlight the benefits of joining the organisation, that, you know, people will be on NHS terms and conditions, which is a real positive. And thinking about the sort of the standing of the organisation, our track record for delivery, the robust support systems that we do have in place, and the opportunities for career development. So although people will be coming into peer support worker roles at the onset, there is the potential for training and development within the organisation. So we have psychological wellbeing practitioners at a band 5, for example, where we actually provide training on an annual basis. Well, we access training on an annual basis. So there is potential to progress into other roles, which I think is probably an attractive proposition for people who might want to be taking on these roles. What we'd look to do as well is continually develop the peer support workers. So we'll be looking at the opportunity for them to engage in some formal training, peer support worker training, but we'll also be looking to look at their individual need. So as well as sort of appraising staff within the process, we'll also be looking at implementing a train needs analysis, which we do with all staff groups on an annual basis. That'll be an opportunity to identify any training needs, and then what we'd look to do is then incorporate those needs into an annual training program that we'd implement over the course of the year to continue that professional development. And what we've got in the services is a wide range of clinical expertise. So we've had people present at national conference. We've had therapists involved in developing national guidance. We've contributed NICE guidance. So there's, I suppose, there's a quite a sort of an attractive proposition there for people who would potentially want to come into these peer support worker roles. And I think it's important that we were able to communicate that message to attract people to the posts. Next slide, please.
So this slide gives you a little bit more information around the organisational responsibility, and particularly around supervision and support. So Simon will talk a little bit more about that.
So I think at the onset, again, it's important that we apply the competency framework for mental health peer support workers. That we look to develop the peer support worker roles, so they're not static. Essentially, we're taking information as we go along from the PCNs, from service users, and from the peer support workers themselves, in order to continue to identify what the needs are of the community and what the needs are of those individual peer support workers in terms of continuing to develop them. I think at the onset, what we need is clear expectations of the role, so that the organisation, the service, the PCNs, the peer support workers themselves, and the community have a clear understanding of what the role is going to entail. We sort of talk there around sort of training and development, and that's something that we'd continue to look to do. There is formal peer support worker training, and for those peer support workers who haven't accessed that training, that we'll be looking at that as a priority. But as I say, we'll be looking to continue to develop the peer support workers during their throughout their role. We're looking at some supervision systems that we have in place, so robust management supervision, ensure that they do feel that they're supported. In terms of clinical development, we'll be looking at clinical skills groups and clinical supervision, and we're generally looking to promote their knowledge, skill set and competence through an ongoing process. And what we'd ensure is that the values of peer support are underpinned in the process, so that inclusivity, respect, reciprocity and mutuality. Next slide, please.
So this slide is telling us a bit about the mental health development workers and their role in relationship with the peer support workers. Again, quite key and an integral part of allowing or enabling peer support workers to have the greatest impact, I guess, in supporting mental health needs. Simon, do you want to tell us a bit more about this?
Yeah, so these roles will be band 6 roles. So they will have a sort of a strong leadership element to the role in terms of, you know, supporting the peer support workers, acting as an advocate for the peer support workers. You know, a focus on community engagement, so really engaging with the community, the PCNs, services, service users, pathway managers, so again, to try and develop that good understanding of the community needs. Developing the voice of people with lived experience to shape service provision, so that get a real sort of engagement element to the role. Looking to problem solve barriers to engagement. Targeting hard to reach groups, whether that's the BME communities, older persons, LGBTQ+, people with long-term health conditions who maybe have challenges in accessing services. To undertake client-centered interviews, and there will be a small element of the role where they can deliver some short-term psychological interventions as well as part of their ongoing development. That will be part of the requirement of the role. And to provide group activities. I think what's important is that we ensure that we avoid duplication. So we've got a good understanding of what exists in the locality, but also what those gaps are in provision, so that we can look to sort of fill those gaps. Next slide, please.
This is probably the bit that is not most important, but gives you a bit more information around what the peer support workers are going to be doing or expected to do. And again, with the caveat, this is very much early stages of development, and we will want to kind of mold this and have a very good mutual understanding around expectations before the team come into post. Thanks, Simon.
So, I mean, this, you know, we've just put some examples of what the peer support workers will be doing within the role. It's a pretty much exhaustive list, to be honest. So the peer support worker roles will either be in a band 4 senior peer support worker role or a band 3 development role. And that'll be dependent on their experience. So I'd expect the band 4s to have some experience of the role, to potentially be trained in peer as peer support workers. And to act as role models for the band 3s, to support the band 3s, to help them transition into the role. And we'd expect those band 3s maybe not to have that same level of experience, but to have the skill set that would enable them to transition into the role and develop the skills necessary. We're looking at, I think what we are looking at is looking to develop, as I say, these roles as well. So what we'll be looking at with band 3s is to develop them into senior peer support workers, and potentially for the band 4s to transition into more senior peer support workers or into other roles within the service. So people do see it as an opportunity for career progression. Would see them as being embedded within the PCNs, obviously that have lived experience of mental health challenges, looking to support peers in the community, build on that shared experience, help navigate mental health pathways, interface with the wider mental health services and community, support personal recovery. And when we talk about personal recovery, we're very much talking about, you know, helping people to achieve their individual goals, help connect with local groups and activities, act as an advocate for peers in the community, provide a range of psychological approaches. I think what we're talking there, I think initially we'll be looking at things like self-help, psychoeducation, etc., and to promote overall recovery. So getting people into a place where, you know, they can progress, move on with their lives and accomplish their goals. And liaise with our peer support workers to develop best practice, which I think will be key as part of that induction process, but also ongoing within the role, that we ensure that there is ongoing communication across the network, with almost like having a peer support worker network itself, that can bring peer support workers together and look at developing best practice, sharing ideas, sharing good practice, and continue to develop the role in a positive way. Next slide, please.
Thanks, Simon. It's a really good point that actually we're not expecting peer support workers to work in isolation on their own. That you should see from the slide presentations that there will be a very good network of support and working amongst themselves, communication amongst themselves as well. Clinical team manager, again, is another critical role in relation to that support. So Simon will tell us a little bit more about that.
So the clinical team manager will be a band 7 post, and they'll be responsible for managing all staff in the project. And the clinical team manager is a role that's established within our organisation, so that there's a clear criteria and expectation for that role already in place. We'd expect the clinical team manager to have a strong interface with the leads within the 5 PCNs. They'd also have responsibility for providing clinical supervision to staff within the team, playing an active role in developing protocol and policy, setting standards, and being involved in the audit side of things, reviewing the project as it progresses, and having a close relationship with our data analyst team in terms of collecting data and ensuring that the objectives that were set are being achieved, looking at any areas for further development, and continue reviewing the process as it proceeds. Next slide, please.
Simon, do you want to talk us through the peer support workers supporting employees?
Yeah, so I think it's essential. I think when we've got peer support workers that coming into new roles, that we've got a really robust system in place for ensuring that they're supported. I think they're really challenging roles in many respects. I think for some of the peer support workers, it'll be a new role for them. It's going to be a new project. They're going to be working with a completely different set of colleagues, and from an organisation perspective as well. These roles are new to our service, so it's important that we ensure that the people who are coming at these posts are well supported. So as an organisation, and particularly as mental health services, we have a mental health services wellbeing strategy plan. And what underpins that is our wellbeing strategy group, which is very inclusive. So we have people involved in that group from all services, from all different roles within those services, who meet on a monthly basis to look at how we can support wellbeing across the mental health work stream. What we would seek to do is include peer support workers within this strategy, so they'd get the opportunity to be part of this group, to contribute, to bring up any ideas that could help support their wellbeing. In terms of our wellbeing strategy, it's been recognised at a national level, so the IAP national team have used our service as a case study, which will be shared with all other IAP services in the country, which I suppose demonstrates where we are with regards to wellbeing, how we see that as a priority, how we support staff, and I suppose we see the sort of benefits from that in terms of low sickness levels and very high staff retention levels. Every person coming into the service would experience a work stress risk assessment, which would be ongoing. We've got access, obviously, to occupational health services, and we're also in a very sort of beneficial place in that we can provide psychological interventions to people within the services by using other services within our work stream, and obviously that would provide priority access to any mental health psychological interventions that might benefit that individual as part of the support plan. We would offer management and clinical supervision, which would obviously be an ongoing process. And what we'd also offer is facilitated peer support, so bringing the peer support workers together, ensuring that they've got the opportunity to support each other as part of a sort of wider team, ensuring that they're not isolated within their individual PCNs. And then obviously we'd ensure that support from the wider team was in place. They're looking at obviously the clinical team manager and the band 6 workers within this part of the project, but obviously having access to that wider support from the mental health work stream. Next slide, please.
Just an update of where we are now.
So all posts have been approved via our executive board. The job descriptions and personal specs have been devised, and the recruitment authorisation forms complete. So just in the final trust processes prior to going out to advert, with any posts within the organisation, they need to go through a job evaluational panel when they're new posts. But obviously there'll be no issue with that having already been approved by the executive board. So we're looking to recruit from January 2022. And I suppose with that, that's where we'll need to be getting other services on board as part of our recruitment strategy to ensure that, you know, we do recruit the best candidates for the posts. So that's in summary just where we are at this particular point. And I think the next slide is probably any questions.
Okay, thank you both. Does anyone have any questions or comments for David and Simon? There's no hands up or comments, guys. I think it's just, again, I think it's a really exciting area of work, and I think as the previous presentation, you know, what really comes through is that kind of partnership work and then connectivity with communities. And I think, you know, real demonstration of how, as part of the community mental health transformation, we are trying to bring everything down to that community level and shape around actual communities, rather than, you know, maybe the one size fits all models that we've had in the past. So it will be great to see how these roles develop over time. And yeah, I think, you know, even the development of that career pathway and someone being able to meaningfully contribute and have employment is fantastic. So it would be great to have you come back in a few months' time once the roles are, you know, up and running, to give us an update on progress. I think just picking up on one point there, I think, you know, you said in the recruitment that you would be enlisting help and support from partners, I suppose, to get the word out about these roles and trying to, you know, attract the best and right people to them. So again, you know, I don't know if there's a particular ask for this group, or if anyone on the group thinks that they could help with that, if maybe who they could get in touch with. But I'm sure we can obviously speak to Jake and maybe get something circulated once you're ready to go out to recruitment. That's okay. Yeah, I can see some nods there.
Yeah, no problem. I think I'll be really helpful.
Okay, all right. Thanks both. Thanks for that presentation. Jake, you'll have to keep me right on this one, but I think we're a comfort break. There you go. Is it by magic? So we're running a little bit ahead of time, so I would suggest we break now before the next presentations. And if it's okay with everyone, if we could come back at 11:10 instead of 11:15. Okay, I can see some nods again. So, and I can just see there, Hannah's popped in the chat another link to the Survey Monkey. So just a reminder, if at the end of the meeting you wouldn't mind going on there and yeah, just putting your thoughts down on the session today. So, okay, everyone, I'll let you go for a comfort break and we'll reconvene at 11:10. Okay, thank you.
Welcome back, everyone. And I'm just checking to see. Yes, we've got everyone back now, I think. We're just about to go into the second half of the session, and just a quick reminder: if you've got your mic on, could you keep it on mute? Without further ado, I'll hand over to Kirsty for the second half of the meeting.
Okay, thanks very much, Jake. Yeah, welcome back to the forum, and I think we'll move straight on to the next presentation, which is from Sophie and Ben at Tyne and Weir Archives. So if I can pass over to you guys, and yeah, you can get on with your presentation.
Thank you.
Thanks, Kirsty. So good morning, everybody. Maybe we should start by just introducing ourselves to the rest of the meeting and then get on with the presentation. So I'll go first. I'm Sophie Mitchell and I'm the Communities Lead for our Tyne and Weir Archives and Museums. And we're going to give you a little bit of a background as to what that means as part of the presentation. But just to let you know, that's me, and I work as a part of a central team across the whole of Tyneside, and we're going to talk a little bit about the broad offer and also some specifics around Gateshead in our offer at the Shipley Art Gallery today. So I'm Sophie. Ben, would you like to introduce yourself?
Yeah, sure. My name's Ben Jones. I actually have two jobs at Tyne and Weir Archives Museums. I'm project coordinator at the Shipley Art Gallery, which I'm going to talk about mainly today from myself. But I'm also assistant outreach officer, which is working with Sophie in the communities team, so working more broadly across Tyneside.
Okay, so we'll make a start. So I'm just going to give you a brief overview as to what Tyne and Weir Archives and Museums is. We say TWAM, so I might just say TWAM from now on because it's a bit of a mouthful. But TWAM is your local authority museum service for Tyneside. So we've got 9 different venues across the region. So in Gateshead, we've got the Shipley Art Gallery. In Newcastle, we've got the Hatton, the Hancock, the Leah Art Gallery, Discovery Museum. In North Tyneside, we've got Segedunum, Roman Fort, and the Stevenson Rail Museum, which is the Heritage Rail Line. And in South Tyneside, we have South Shields Museum and Art Gallery and Arbea. So we've got a real mixed bag. Excuse me. Actually, I should say as well, of course, we've got the archive service for the whole of Tyne and Weir, which is housed at the Discovery Museum. So we've got a real mixed bag of venues, so art galleries, museums, World Heritage sites, archives, and there's about 3 million different objects within that collection and just under 200 members of staff as well. So we're quite diverse and varied. So I really do believe when people say, oh, there's something for everybody, I think we can definitely claim that. Could we have the next slide, please? So I'm the communities lead, and our culture, health and communities team has been around for quite a while now. And it's our job to work with communities, to work with other services. We work a lot with health and care, and it's really a major part of our role is to fill the mission statement, which you can see on your screen now, which is to help people to determine their place in the world and define their identities, so enhancing their self-respect and their respect for others. So that's a big part of what the Culture, Health and Communities team do. We work centrally and we work with all communities to really deliver on that promise. Can I have the next slide, please? So today we're going to talk about the wider communities team and how people might want to get involved or access the sort of programmes that we provide, and we're going to talk specifically about the Shipley Art Gallery as well, because obviously that's very relevant to the forum today. Okay, next slide, please. So I'm going to give you a little bit of a background on the Culture, Health and Communities team. Next slide, please. So we kind of really take this statement to heart when we think about our programmes. We're very concerned with health inequalities, and we're very concerned with access to culture. So two very historic, unequal areas of society, and we're really interested about how we can bring those two things together, health and culture, and how we can use them as a really as a mechanism in response to kind of improve people's lives. Next slide, please. So the Culture, Health and Communities team, of which Ben and I are part of, we're a team of museum professionals. We've been in existence for over 20 years, so we're really lucky actually within TWAM, because you won't find a team like ours within most regional museum services. You might find them at the nationals, but actually we're really lucky that within the Northeast, this area of work's been prioritised within a museum service. So we believe in strategic partnerships. We believe in being relevant. So we're very concerned about how we can work with other services who are delivering frontline services to people who might not normally visit the museum, and think about how we can provide programming to improve their outcomes. We work a lot with health and social care professionals. We work a lot with local authorities, universities, charities, support services. I think a lot of people on the call today we've had some involvement with, in the past. Next slide, please. So what we've done really is look at the landscape and gather public health and social data to create our response. Our programmes are really in response to the need within the region. So we've taken all of that information and we've got like quite a strategic way of programming our community offer and thinking about the audiences that we'll work with. So thinking about all of the data, and that's the data for the 4 Tyneside local authorities. We have devised programming targeted to 4 specific audiences. So they are the Wellbeing Programme. Now, the Wellbeing Programme promotes positive mental health and general wellbeing. So we work a lot with services, support services, charities, third sector, and of course also clinical services as well. The Platinum Programme is for over 55s, and that's a very broad programme where we might be doing some really specific work with groups of older people who have quite high need to kind of engaging with the Elders Council and being really proactive. We've got the Recovery Programme, which is for people who are in addiction recovery. So we can provide some really lovely creative sessions around working with people within those services. And the Network Programme is really kind of more old-fashioned community development piece of work, like something that we might go into a very specific locality to address an issue that's been raised. So the programmes are strategic, and we're willing to kind of change and flex as needs change as well. So that's why we feel it's really important to kind of listen to, all of the things that have been happening this morning so far, so we can take that back and inform our next moves as well. So next slide, please. So here's just a little bit of information. So the Wellbeing Programme is our mental health programme. Next slide, please. And then we've got the Platinum Programme. So there's just such a wide range of work that goes on across these programmes and across, Tyneside. I think because this forum is like place specific, something that we really should mention when we're talking about the programmes and we're talking about the people that we'll work with. just because we might be working in a specific area, there's no expectation that people have to work with the local venue. You know, it's about people having access to the whole of the collection, and also about us being able to reach people in their communities. So we do a lot of work in the community, we do a lot of work in venues, but we're really very flexible. Next slide, please. So the recovery programme, we had our latest programme in Gateshead was something that Ben led on actually, which was with Recovery Connections, and that was a piece of work that we did with service users around sound, and some really, really lovely creative sessions around sound and well-being. Next slide, please. And the network programme. So again, that's really thinking about the issues that are specific to localities. So at the moment, the network programme's been doing some work in Chopwell with the Methodist Home Association and some older people up in Chopwell, again using sound, actually a bit of a theme for us. It's been a sound heavy year, but the programmes are really varied in terms of creative output, so that's been really successful, and we're thinking about next steps for Chopwell. Next slide, please. So who do we work with? Well, what we tend to do is work with service providers, so health and care professionals, local authorities, support services, charities, etc. And we do some quite specific focused pieces of work with experts in their field. So we kind of listen to our colleagues across sectors, because that's something that we're, you know, particularly interested in, working out how we can think about the museum service, which is for everybody, as a resource and a community asset, and something that's relevant and that's transferable across sectors. So we work with a whole host of people, and you know, we're always kind of open to working with more people and making new contacts. So do get in touch if you're interested. Next slide, please. So apart from the face-to-face delivery or digital delivery, which we have been doing alongside face-to-face delivery during the pandemic, we've also got some really innovative resources that are available for other professionals and community leaders to borrow. So we've got things like museum object handling loans. We've got tools for engagement. We're working on something at the moment with a group of occupational therapists in North Tyneside, where we're devising an engagement tool around sound that can be used with older people. It's being trialled on some of the organic illness wards in North Tyneside at the moment, and that's being used to kind of create life story and biography work. So that's an example of an engagement tool. Online tutorials and professional development opportunities, which is something that we're very much interested, because we're quite a small team, although we're very progressive and though we're very productive, we're quite a small team. So we do realise that in order to really ensure that this work is relevant and does cut across, that it's about working with other professionals to help them to use creative interventions. Next slide, please. So something that we're really interested in, like I say, is this idea around professional development with health and social care staff. So one of the things that we've put together in the last 2 years or so is the museum's health and social care service. So this is something that anybody on this call now can go onto the TWAM website and download and use. And this was put together with a team of museum professionals and a steering group of health and care professionals. We worked with Northumbria University. So what we did was look at creative activity and really sense check that against clinical outcomes, and translate that into a sort of a shared language, because obviously we know that we're, you know, different sectors, and we need to be able to kind of cut across those sectors, and we're not always looking for the same terminology and the same data. So this was a really considered piece of work to really help to contribute towards that. So we'll look at different creative activities, and then the health and care staff have sort of sat down and looked at the clinical outcomes that are possible with those creative activities. So we'd look at cognitive and learning, would look at physical mobility, mindfulness and emotional, and social outcomes. So what we might see as, for example, something we're looking at a Roman herb garden, which is the slide that's up now, talking about the medicinal uses of Roman herbs in the past, and the sensory experience of crushing herbs and smelling herbs. An occupational therapist or a mental health nurse could, give a completely different spin on that. So that's what that resource does, and it's there for everybody to use, and it kind of explains, how you can, adopt creativity into your practice as well. Next slide, please. So obviously social prescribing is hugely on our agenda as well, and it's something that we've been involved with in terms of the Thriving Communities fund from the Arts Council that came out this year, and we're really interested. I was really glad on the last presentation when somebody mentioned about gaps and filling gaps, because I think a service like ours is really important to be able to do that. So we're really interested to hear from link workers, and I know that we've worked a lot with the Gateshead link worker group, and they've held events at the Shipley and worked in our team, which is great. But we're really interested to hear about how we can fill gaps, because we've got such a lot of opportunity, we've got venues, and we've got quite a lot of freedom actually to run creative sessions. But generally speaking, a lot of the groups are closed. So we're interested to hear what the gaps are. So we might start new pieces of work and collaborate that way. We do have open programs, and Ben will talk a little bit more about that. So there is, there's opportunity to self-refer as well. But in terms of meeting that, untapped potential for social prescribing, we're really keen to, have that dialogue. Next slide, please. And just to say that we're also very interested to think about our spaces as a space of social care. We've been involved in a lot of academic research in this area. There's a book published last year by Dr. Newell with a lot of kind of focus on TWAM, because we're quite we've been doing this work for a long time actually. So there's quite a few papers, and we're very concerned with the Culture, Health and Wellbeing Alliance, which we lead on in the region along with Equal Arts. So there's a lot of opportunity to kind of ask those questions and find out where they lead. Next slide, please. And I'm going to leave it there. That was a little bit about the central programs within TWAM. And I'm going to hand over to Ben now, who's going to talk more specifically about the offer at the Shipley Art Gallery now. Thank you.
So hi everyone. So my name's Ben. I work at the Shipley Art Gallery. I'm going to talk more about specific, obviously, the Gateshead gallery that we have as part of TWAM and what we do at TWAM. Sorry, at the Shipley. So I job share with a colleague called Hannah, and our main role is about using our collection, using creative activities at the gallery to work with and support local people's health and well-being. So next slide, please. So this is the Shipley Art Gallery, if you don't know. We are in central Gateshead on Prince Consort Road. We're in the middle between central Gateshead, Benjamin Saltwell, Deckham and Lowfell, close to Gateshead Central Library and Gateshead Leisure Centre. Next slide, please. And our main kind of collection is, well, it's a mixture of arts and craft gallery. So we have 16th and 17th century Italian Flemish painting, 19th and 20th century British painting. We also have a large craft and design collection. And most of our galleries, if not all of them, are permanent. So a lot of our jobs, or my job, is to activate these spaces through workshops, through working with community groups, through talks and events, supporting and working with statutory organisations and working with community groups. Next slide, please. Like I said, we have a large craft collection. We've been collecting crafts since the 1970s, and it's actually one of the most significant craft collections in the UK, which we're quite lucky to have in Gateshead. And this is kind of a focus on what we're looking at the moment, in particular around how we work with community groups. And it started as a way of trying to collate and record crafts, in particular Northeast crafts, that were disappearing in the 1970s. Got stopped making or using craft techniques. And like I said, this collection is a lot of what the work we do around working with community groups and health and well-being. It's a mixture of ceramics, glass, jewellery, woodwork. It's got a first century Roman oil lamp up to contemporary glass, contemporary craft. So a large, long mixture of craft in the collection. Next slide, please. So these are the Shipley's main three key strategic aims. So it's about using the collection to support people's health and well-being, with a particular focus on isolated older people, people with dementia and mental health issues. So the Shipley actually reports to public health through Gateshead Council. So a lot of what we are reporting and what we have to do has to have health and well-being aspect to it. It also is about maintaining strong links with local community groups and the local communities. So like I said, we sit in the middle of these areas in Gateshead. So a lot of the work we do is about working with the groups or communities that are directly around the Shipley Art Gallery itself. So of course we do work across the borough as well, but we have a strong focus on Benjamin, Saltwell, Deckham, Lowfell and Central Gateshead. And we work with community groups and organisations and schools that work in these areas. So we're part of a collaborative organisations such as the Best of Benjamin Collaborative, and we have strong links with lots of different groups and schools and organisations across Gateshead. We also have a lot of work with local school groups. This is an ongoing thing that we've been done for a long time. A lot of the primary school groups that are in the immediate area. We recently, at the beginning of this year, Gibbside School moved behind the Shipley. It just had a new building built behind the Shipley Art Gallery. I think they opened in February this year. So we're developing our links with Gibbside SEND School as well. So we've got strong links with local schools and, as well. The next slide, please. So the Shipley works in a number of different ways. Like I said, it's about how we can use the space to support people's health and well-being. This is an example of some of the regular user groups. So these groups come in on a regular basis and use the Shipley. We support their work, we work with them. So we have an example, I'll go through a few of them, but NHS Art Therapy Group that comes in every Tuesday afternoon, mainly working with people with learning disabilities and mental health problems. It's run by an art therapist who comes in and runs the session, and we've supported his work. We've also got a group of young people coming in through the NHS as well at the minute on a short-term project. This is a young people group run by an art psychotherapist, working with their families as well, so the young people and their families. So we already work with some NHS organisations. We also work with Equal Arts. If you don't know who they are, they're an arts organisation that mainly works with older people with their Creative Friends and Cultural Adventures group. So I think Creative Friends is for people with bereavement, and Cultural Adventures are for carers or people who are cared for. And then we have these other organisations as well, some small, very small informal community groups, as well as working with statutory groups. So apart from those regular groups, next slide, please. We also run sessions ourselves, the things that we have instigated. So we have family art and craft sessions that usually take place during the school holidays and during the weekends, about supporting families in the region, in the area. Adult art and craft sessions, which are for adults, obviously, support local people and help them with arts and craft sessions, working with local artists sometimes. We have a make and play baby social, just a recent, we've always been doing it for a long time, but we've recently changed how we do it. So we're kind of focusing with that on the parent rather than the baby. and it's particularly for new parents, so with babies between 0 and 6 months. And it's about using creativity to support the parent, where the parent is the focus rather than the baby. And it's about kind of, using creativity to support their health and well-being, and give a social kind of event where they can meet other parents who have very young babies as well. Like I said, we work with community groups. So we've worked with, I think someone mentioned Rococo at the beginning, and Tyneside Mind as well. And we've worked with Comfy Project. So we work across lots of different community groups that are based in the area. Like I said, local schools, university and further education students, college students as well. And we've recently started working with or talking to social prescribing link workers that are based at Edwards House in Felling, seeing how we could link with them as well. We're interested in working with GPs as well, and seeing how we could target the groups that we want to work with based on our student aims. So we're working with social prescribing link workers and sending them information, seeing how we could support people with them as well. So next slide, please. So this is an example of a project that we might do. So this is part of the Rothschild Community Projects. It's a bit of funding we have. Every year we work with a community group in Gateshead to look at this particular craft ceramics collection that we have at Shipley. This year, because obviously we couldn't do it last year, we were working with 2 groups. We have 2 projects at the minute. One was with Rococo, and we have one at the minute that's ongoing with Young Women's Outreach Project, and we work with Benjamin Grove Community Centre, and 2 ceramicists, Mella Shaw and Annabelle Talbot. And these photographs give you an idea of the kind of process that we've gone through. So it's, a lot of the people we work with. So I did the Rococo project, my colleague Hannah working with Young Women's Outreach Project. So these are from what we did with Rococo. A lot of the people who came to that were new to ceramics. Some of them had done it before. One of them was actually an artist who had kind of stopped his practice, and he was going to Rococo. And it shows the process of how we started and how we worked with Annabelle Talbot, working with Rococo in Sotwell Park at the retreat, coming to the Shipley, looking at the collection, working at Benjamin Grove, and then showing their work in the art gallery itself. So at the bottom left, you see their work, the work they produced in the art gallery, and the Young Women's Outreach Project will have the opportunity to do the same. And this particular project was about, the theme was smell, and thinking about what were the smells that you that comforted you during lockdown, what were the smells that you missed, or maybe you didn't miss because of lockdown. And these are the kind of artworks they produced as part of that project. So this is an ongoing project. I think we have a few more opportunities to work on the Rothschild project. Will be next year now. So we're open to obviously people who are maybe interested in being the community group or the group that we work with on this. Next slide, please. So these are a few comments from the Rococo participants. Like I said, some of them had never done ceramics before or did anything creative. And now some of them have started going to Benjamin Grove, signed up for adult learning courses and learning skills courses. One of them, like I said, he was an artist who stopped. He was studied as an artist, but he stopped his practice, and now he's suddenly got back into making art again and started going to Chile studios and thinking about being an artist again. So it kind of inspired him to kind of think about what he wanted to do. Next slide, please. So how we could work together. So these are the kind of things we're hoping to, what we do and what we're interested in. So we're welcome to work with new groups and organisations. As Sophie said, we're kind of up for conversations and chats and just seeing what people are interested in. We're very flexible with how we work and how we could work with people. I'm interested in learning, finding out about what you want to do and seeing if we can support you in that way. Using our collection and using the art gallery itself and creative activities. Like I said, we work across Gateshead with older people, young people, families, adult learners, asylum seekers, refugees, mental health and wellbeing groups, and many more. Interested in long and short-term projects. So if you want to talk to us about coming in and doing a year-long project, or whether you just want to come and do a 6-week project, or whether you just want to come and have a one-off session and just have a look around the art gallery, all that's fine and all that's great. We'd love to hear from you. Interested in working in partnership, maybe look for funding, seek funding and working on projects. So again, just come and have a chat. And like I mentioned, social prescribing is something we've started making connections with Gateshead link workers connected to GP surgeries. So for the baby social that I talked about, we've managed to get an advert in some GP surgeries on the screens they have in the GP surgeries. So hopefully trying to reach the people that we're that particular activities for. And then finally, we have the Shipley Community Network, which is something I'm hoping to develop in the new year, which is really about training and skill development, trying to bring together a group of local people, excuse me, to use the art gallery to develop new skills and training, maybe soft skills, maybe about helping them around public speaking, but using the collection, and also peer support and development and community development as well. And that's something I'm hoping to develop next year. And these, like I said, we're happy to have chats and conversations. I think the next slide, please, has our emails, I think. Yep, so this is our emails if you want to get in touch with us. You're welcome to get in touch with both of us or either of us. And we probably, if we can help, obviously we'll help. We might just pass you on to another one of our colleagues who may be able to help you and work with you. But like I said, we're up for conversations, both for Sophie and myself, about the Shipley and our communities team as well. I think that was it. So any questions, we're happy to answer questions.
Okay, thanks both. Does anyone have any questions or comments for Ben or Sophie? No questions coming forward there. I'd just like to say thank you. That was a really informative presentation, and I, for one, would certainly like to hear more about your programmes and how we can link together with the various transformation programmes that are going on across Gateshead at the moment. So either myself or my team will be in touch. But thanks, that was great, and thank you for coming along to present this morning. Okay, we're on to our last presentation. I will move swiftly on there because I'm conscious of time. So if I could invite Jennifer and Lauren in, who are going to talk to us about their review of patient participation groups across Newcastle and Gateshead.
Thank you, Kirsty, and hello everyone. Thanks for coming along today. I'm Jen Rogers and I'm here with my colleague Leah Lamb, who's here in place of Lauren, who couldn't make it. So we're from Involved North East, which are an organisation that some of you might have worked with before or heard of before. But if not, we're an organisation who's commissioned by Newcastle and Gateshead Clinical Commissioning Group. And we work on patient and public involvement through projects such as the one that I'm going to be talking about today, which is patient participation groups across Newcastle and Gateshead. Next slide, please. Thanks. So first, I'll just provide a bit of background to this. Newcastle Gateshead Clinical Commissioning Group want to support practices in developing their patient participation groups, or PPGs. In 2019, Involved North East produced a toolkit, and that was designed to help support practices in developing their own PPGs. Due to some widespread structural changes that were going on throughout the NHS, such as integrating the systems, and also some wider factors that were going on in healthcare, such as the pandemic, it was considered timely to conduct a mapping exercise just to understand what the current level of PPG activity was across Newcastle and Gateshead. It was something that also evolved from the Newcastle Patient Forum. The aim of this was to develop a strong foundation for patient care and public engagement. The methodology that we used was that in July 2021, GP practice managers were contacted and they were asked to complete an online questionnaire or a telephone interview. 56 out of the 60 practices contacted provided feedback, and this is a snapshot of this time period, so it may not be relevant to what current PPG activity is like at the moment. And these findings were from the September 2021 report. Next slide, please. So today I'm going to be talking just about the Gateshead practices. Obviously that's relevant to this forum. 26 practices responded, 24 of which had PPGs, and as of July, 7 of them were currently active. And also 50% of those practices had a dedicated PPG chair. The 2 that didn't have PPGs did give some reasoning for this, and the reasoning for that was pressures on the practice, meaning that they were unable to organise some meetings, and also failed recruitment activities or patients not being interested in being recruited into the PPG. Next slide, please. So I'm going to show a series of charts just to represent what the findings were. We initially asked them, how does your PPG meet? Pre-COVID, nearly 3/4 of the PPGs were meeting face-to-face. As of July, none were meeting this way. The 7 practices that were active were communicating through online methods like video calls or via email. All of the practices who fed back were saying that going forward, they'd be interested in using some combined methods to be communicating. We also asked how, on average, people were meeting. That was usually quarterly. Next slide, please. As you see on the slide, there's a range of ways that PPGs were recruiting people. Most commonly, that was done through in-practice advertising, so that would be posters or leaflets or videos on the screens. That was followed by using the website, and also other ways that Gateshead practices were recruiting people was through advertising this on patient registration forms and also using social media. Next slide, please. We then asked how many members the PPGs had. There were, as you might expect, less members as of July than there were pre-COVID. One of the practice also fed back from that, saying that the PPG members had had little time to engage with the PPGs anymore, as they'd had to take on care and duties due to COVID. On average, there were between 4 and 6 members of the PPGs, and that was both pre-COVID and as of July. Next slide, please. Practices were then asked what groups they felt were underrepresented within the PPGs. And this is because the PPG should really provide an accurate snapshot of the demographics of the local area. Practices replied saying that they felt that there was most commonly a lack of representation for people who were under 50. Next slide, please. Then asked how they kept their wider patient population informed of the actions of the PPG. 65% of practices were using their website for this purpose, and that was followed by a more traditional newsletter and also advertising it on social media. Next slide, please. Practices were then asked what they felt was working well within the Gateshead practices. The opportunity to gain valuable feedback from patients around service provision was mentioned most frequently. They also felt that having face-to-face meetings and also having a patient-led group were things that were working well. The opportunity to share practice information with patients was also noted. And one practice in particular had said that for them, having 2 different PPGs, which were aimed for different demographic groups, had worked well. Next slide, please. They were then asked, on the other hand, what they felt wasn't working so well within the Gateshead practices. Generally, recruitment was mentioned, and particularly recruitment of specific underrepresented groups. These were the most frequently highlighted areas that they felt that things weren't working so well. 2 practices had also said that they'd found it difficult to get some members to take greater ownership of the PPG and also to recruit a patient chair. And one practice also reported that they were struggling with the online format that they'd had to adopt due to COVID restrictions. Next slide, please. So the findings that we had, and to summarise them, the main finding was that patient involvement was appreciated by the GP practices because this was allowing for 2-way communication. COVID-19, as you might expect, had meant that the majority of PPGs were paused, but the impacts of COVID-19 weren't entirely negative. That had led to the use of new communication tools, such as I've mentioned, like online video and email and telephone. Communication channels were opened, and it was also offering people a bunch of different ways to get involved instead of the time commitments of engaging with a face-to-face meeting. Most of the practices involved also said that they were planning on using a range of different methods when they were going forward. As I've mentioned a few times now, recruitment was the main issue, that the PPGs had noted, and also disproportionate representation. Another issue that was identified was that there'd been a lack of interaction between the organisations. So in this instance, I'm talking about PPGs weren't able to interact with other PPGs, but also the PPGs weren't able to interact with the primary care networks that they were part of. Next slide, please. We made 23 recommendations for Newcastle Gateshead Clinical Commissioning Group, GP practices and the primary care networks to consider. For NGCCG, that included sharing the Involved Northeast Toolkit, which is what I mentioned right at the start of the presentation, the PPG toolkit that's designed on providing guidance on how to set up and get the most out of your PPG. We also offered that ourselves in Involved Northeast would run some sessions at the GP timeouts, and that would give us the opportunity to go through the toolkit with the practice staff themselves and answer any questions that they had. For practices, we recommended that they look at recruitment and then find out what the barriers are for people to become members of a PPG. Also recommended that they consider working with voluntary community sector organisations to try and reach those groups that have been underrepresented within their individual PPGs. And also to engage in more joined up working with other practices, which would give them the opportunity to share best practice with each other. For primary care networks, we recommended that they develop a PPG involvement network. And this would be a way to allow PPGs to interact with other PPGs that are based within the same network, again, giving an opportunity for them to share what's working, what isn't working so well. And that they explore the opportunity to offer some training. And that would be the PCN delivering training to PPG groups and the members of those with the hopes of developing their skills and competence so that they can go on to chair a meeting and also taking greater ownership of the PPG. Next slide, please. Next steps from this are that this report that I've just given you a quick summary of has been circulated to the clinical directors of the PCNs. They've been asked to consider and review the recommendations, and the report's also been circulated to practice managers so that they can have a look at it on a more localised level. If you just go on to the last slide. So that's a very quick overview of that report from September. Thank you very much for listening. I hope that some of it has been useful, and if anyone has any questions, me or Leah will try our best to answer.
Okay, thanks very much. Any questions? No, I just have one, and it was just to ask: is this a review that's done on an annual basis, or was it just a one-off piece of work to understand the impact during the pandemic?
Leah, would you like to take this one?
Can you hear me now?
Yeah.
Sorry. Sorry, I've got a little helper. Yes, it was a one-off piece of work to begin with, Kirsty. As Jen said, it came about as a result of discussions within the PPCEF steering group a little while ago because of the implications of the pandemic and people just wanting to know what was actually happening and how practices were coping with it and whether everything had been put on the back burner. But I think it's something that we could certainly do on an annual basis or perhaps a 6-monthly basis, depending on, you know, pressures on practices and things like that. I think it would be a really useful thing to kind of map over time and see what sort of changes are occurring and whether any of the recommendations that we've suggested have been taken up and what impact they could have had. So I think it would be useful to do that again.
Yeah, I think that's why I was asking, you know, and I think especially at the moment, the pressure some of the GPs are under and the ability to fit all of this in and obviously the impact that it's having on, you know, the patients within their particular surgeries as well, you know, it's really difficult. Jake?
Thanks, Kirsty. I wondered if our Involve North East colleagues could put their contact details for people on in the chat, please. Just because I'm conscious that there's some people on from GP practices themselves, and if they're interested in taking up the offer of accessing the Involve North East toolkit, or indeed having Involve North East do some timeout sessions for them, or indeed for the PCNs as well for the training offer, to get in touch, so that we can help facilitate that. So. Thanks, guys.
Thank you.
Okay, that's great. We'll have no more comments or questions. So thanks both for that. Just like to say another thank you really to all of the presenters this morning. I think we've had some really informative presentations, and certainly, you know, things that it would be good to come back in 6 to 12 months and just to report on progress to see how things are going. I see Jake's changed the slide there. We'll do one last play to look at the Survey Monkey, and that'll help provide an evaluation of today's meetings. We want to ensure these meetings are as informative, relevant and meaningful as possible, so any feedback is much appreciated. The next forum will be in March, and invites will be sent out once the date is finalised. The recording is published on our website, and I think all that's left is to wish everyone a Merry Christmas, and we'll see you all again in 2022. So thanks for everyone, thanks to the presenters, and thanks for those attendees. Okay, bye.